Good afternoon. It's 1:30 on Friday, and Mark Ramey, Chairman of the Marion County Board of Supervisors. I have Kim Dorn, Director of Marion County Public Health, joining us via phone. Wanted to provide you an update on where we are at related to coronavirus. This will be a short update. We know there's been a lot going on in Marion County. We've had new cases, and Kim's going to give us an update on the cases, where we're at right now, and give you the latest information from a Marion County perspective. So, Kim, can you hear me?
I can hear you. Yes.
Great. Well, thank you for joining us this afternoon. If you could just run through the numbers and kind of where we're at from a public health standpoint.
Sure. Currently, we have 54 active cases, and we have 211 folks who are recovered, and we are still working through several new cases, so that active case number will come up as soon as we have worked through those other cases and get those up on the count.
Okay, so the numbers that are on the State of Iowa website don't reflect what you're seeing right now within the county, correct?
No, they're not going to match. They're just not going to match right now.
Okay. So we want to make everybody aware that as we work cases here from a Marion County public health standpoint, that if you go to the state website, those numbers are not going to be the same. And Kim has the most accurate information, the most up-to-date information regarding where we are at relative to COVID. So with those active cases that we know of right now, we are in the process of contact tracing, correct, Kim?
That is correct. We're working through the active cases. Those 54 cases that are active. We have initiated the contact tracing and got the lion's share of the majority of that done with those. The new cases we continue to work through, and so as we work through those will come into that active number.
Okay, very good. I think there are some things we just need to highlight again. We wanted to make sure you had the most recent information from a Marion County standpoint, but social distancing still absolutely critical to slowing the spread. Even as we see a little bit of a spike in our cases, we've had we had a big event in Knoxville, and I'm sure we will have other cases arise as schools begin to reopen and other things begin to reopen. But just as we had at the beginning of this coronavirus crisis, the same holds true now. And social distancing, washing your hands, staying home when sick, wearing a mask in public when you can't socially distance, those are critical behaviors. Kim, still the same from a public health standpoint?
Still the same. Still the same. We need folks to really be diligent about the social distancing and staying home when you're sick, or if you happen to be a test positive and you feel fine, you still need to stay home until we release you, until we give you the release date. So that's the biggest thing, is if we can get the folks who are sick or who have tested positive to isolate, stay home, and not spread. And then everybody else just needs to make sure that they're staying 6 feet so that they know, so that they are being as safe as they can be.
Yeah. And from a contact tracing standpoint, Kim, when your staff calls somebody, meets with somebody, nobody's in trouble when they call. We just need the information so that we can assist in identifying those individuals who might be exposed, correct?
That's right. This is there's nothing punitive about this, and there's no, there's certainly no shame in having COVID. It happens. But what we need for people to do is to be really forthcoming with us about who your contacts are and that, so that we can tell them to be alert, to make sure that they are watching for symptoms on their, for themselves, and also so that if they happen to be an asymptomatic person, that they're not spreading it to their family and friends, and especially to the folks who have bad outcomes when they get COVID, because many people that we've talked to, there's a good percentage of people who don't have real severe symptoms, and so they think, oh, it's allergies or whatever, but they're actually that they find out they're positive, but they feel fine, so they want to continue to live, just go about their business, and that's how it gets spread. So we need people to really be diligent about following our guidance.
Yeah. Very good. Well, Kim, thank you. Thanks for the work that you and the folks at Public Health are doing. And thanks again to our residents. We want to again reiterate it is social distancing, washing hands, stay at home when you're sick, wear a mask when you can't socially distance. Those are the key behaviors that will again keep this from spreading, that will get us through any of the spikes that we will see as a result of our activities. We want to be able to live our lives, get back to business, get back to the things that we love to do. And if we continue to do these things, we'll be able to do that and weather this coronavirus crisis that we've been going through. It's tiring. I've ran into a lot of people who are kind of tired of all this, and I get it. I think for all of us here at Marion County, we get tired of reporting on it. We wish it was had gone away. We wish there was a vaccine, but there isn't one yet. So continue to do these things. We will keep you updated as we get more information from a Marion County perspective. Thank you for your time. Have a great afternoon.